Welcome to this month's Comprehensive Counseling Initiative video update, exploring the variety of work that schools around Indiana are doing through the Comprehensive Counseling Initiative grant from Lilly Endowment. I'm Matt Fleck, and today our guests are Teresa Brown, Superintendent of Jennings County School Corporation, and Nicole Johnson, who's Assistant Superintendent at Jennings County School Corporation. Welcome to you both.
Hi, thank you.
We really appreciate you being here and doing this. So I'm going to jump right in and just tell us, let's start with you, Teresa. Tell us about one or two of the primary initiatives that you initiated through the Comprehensive Counseling Initiative or the Comprehensive Counseling Grant and how it's going.
Yes, I think social emotional learning has been a big area that we've really concentrated on. And in particular, hiring a director for social emotional learning and also training all of our staff in trust-based relational interventions, TBRI. We've trained all of our staff, our administrators, our teachers, our classified staff, so that everybody has the same language and expectations for how we deal with kids that come from hard places and making sure that we're adjusting the adult response and providing kids opportunities for relationships and just really addressing those SEL needs. So that the grant has been tremendous in helping us do those things.
Nikki, tell me, why did you select TBRI?
We partnered with Hope Alight and have worked with an outside vendor to provide that information to our staff. And from the start, we really felt like it was a great match for what we needed for our children. And also, I think the most profound impact was early on, staff who went through training came out and said, after a week, this has transformationally changed how I parent at home. And so we knew we were on the right path when immediately it wasn't just about moments in the classroom and how we're impacting kids, but impacting our whole community and impacting how the lens that we see the world and how we look at what everyone needs. I mean, it also impacts how we interact with each other and the way that we think first of how a conversation point might impact someone from a different viewpoint. So we knew right away, just from the responsive staff, that we were definitely on the right path with the program.
You know, I think it was transformational, even when we, as the adults in training, took like the ACE surveys. And I don't know how many of our staff even said how many ACE numbers they had that indicated that they had come from a really difficult and challenging childhood as well. So it really kind of gave everybody that understanding and realization to kind of provide more grace. And, you know, in order to do anything well, you have to get to the core of changing belief systems. And I think that TBRI has allowed us to do that so that we can make change happen. It's not something that, you can do to people by just telling them it's the right thing to do. They have to believe in it. Yeah. And I think the training that we offered our staff in TBRI really did kind of get to the core values and beliefs so that we are able to kind of change how we're operating.
One thing I know you mentioned to me, or at least in your report last year, was that if you had to do it over again, probably would have started with training the principals first instead of staff. Tell us a little bit more about that.
Yeah, I mean, I just think that to have, we trained everybody at the same time, but they were in different stages and we did elementary first and then secondary. And so I think our leadership team didn't have that common understanding until all of them got trained. So it's hard to have a district initiative when your leadership team is kind of not all on board yet because they don't even know what it is. So I think that, in retrospect, we probably should have made sure that the leadership team all had that foundation even if we did roll it out in stages. I think that was fine to do it that way. But I think they just kind of needed to understand the vision better by participating in it. Yeah. Once I participated in it, myself, I'm the same way. I wasn't even in the first phase. I think I did it, after they had already done one or two because we had to sign up based on just date availability. And once I participated in it, I clearly understood why it needed to become something that everybody was, participating in and understanding.
I would add too, it's part of it's a unique program and it builds a learning journey. You have the PD, but until you go back and try it yourself and put it into practice, it's a complete culture change, because it's really looking at, instead of this is a behavior and a discipline incident that follows, it's trying to understand why that behavior is occurring, getting to the root of that, and proactively preventing it from occurring in the future, more than disciplining the behavior and worrying about that specific consequence. So it's a real shift in a culture change, and it's a progressive thing that as you try and see success with, it builds up trying more. And so that progressive piece being understood well by leadership and tried first really supports that implementation. But it's just an exciting thing to see as you start to, you take care of the incident that happened, but then you work on the prevention for the future. And as you see that build up and those incidents don't occur because the prevention, the proactive steps are working, that's what's so powerful.
Yeah. You initiated this, I think, prior to COVID. Did it help you when COVID hit and dealing with social emotional issues of students and staff?
Yeah, that's really interesting. We actually started this, we started TBRI about 3 years ago, well before COVID, just because as we looked at our data, it was a clear need. We had to do something about all the social emotional issues that our kids were bringing into schools. We didn't really know what that should be until we did our research and found TBRI. But as COVID played out and people were struggling with supporting people that were going through hard things, including staff, I think having that understanding already with TBRI really helped us move forward more quickly. Even when we did our back to school plan, there were many districts that struggled with even creating what those supports should look like. We already had them. So for us, it was just kind of building it out, and everybody already understood what we needed to do.
You also work with lots of partners on your list. Tell us a little bit about the collaborations you have with community partners.
So we have some extensive things that partner with our comprehensive model, and it includes some STEM work, because part of what we are trying to do is to increase our student engagement level so that the work that they are doing, they're deeply invested in and hands-on. So Cummins has partnered with us to start STEM labs in every building. And we started with a curiosity machine curriculum and having every elementary student experience time in STEM lab weekly. And then in addition to that, our secondary schools are also having some special programming and adding in computer science curriculum and partnering with other community resources to come together. Things like having previous alumnus return and talk to our students about the careers that they're working in, and having a community get-together night where our current students can connect with students who graduated and are in a career that they're interested in. So a lot of powerful community connection things to help our students access how what they're learning is going to create this connection to the greater world.
Yeah. One question we get a lot is about sustainability. I know there's funding, lots of federal funding coming down right now, but beyond that, it's something that you've been able to do to change your culture already. How are you thinking about sustaining this work, both the STEM work and the SEL or the TBRI work, as you're going forward in the future?
Yeah, so with TBRI, we just realized very quickly that in order to have sustainability, we had to really train our own staff in being able to be the trainers of TBRI so that we could bring in new people every year and have that in-house capability. So we have done that with the grant. We've trained through Texas Christian University a couple of our staff members. So they are certified TBRI trainers now. And additionally, we've hired SEL contacts for elementary and secondary. And even within each building, we have contacts now working with those coordinators to help us implement more building-wide, but then have a district system in place to also support it. And then the same is true for STEM. We have a number of, we have a committee in place district-wide that oversees, we have STEM contacts now in each of the buildings, and we continue to make that a district priority in our strategic plan, as well as SEL. We have 3 kind of overarching goals in our district plan. And we ensure that SEL and STEM are kind of embedded in that so that they continue to be a focus for each of the committees that are doing that work.
Yeah, that's wonderful. I'm kind of jumping back, but just a little bit. Was it tough getting staff to buy into the SEL concept? And how did you do that if you did have a challenge?
I think that, again, it goes back to the data. So we didn't just make this up. When we started looking at data 4 years ago, when I first came, that first year, we spent a lot of time kind of just struggling with, what should our work be? Yeah. And as we looked at crisis referrals and, CPS referrals and students with suicide ideation, we had actually even a few, 2 or 3 suicides that had happened in the spring of my first year here. And so there was this whole kind of just glaring need as we looked at the data to address what we were doing for social emotional learning. And that was really before anybody had really started talking about it a whole lot. We only found, I think, 3 other districts that had SEL directors at that point. The state didn't have that information out yet either. So we were struggling with actually, how do we even move the needle on that? Yeah. We knew we needed to address it. We just didn't know how. And so we were a little bit reluctant, to be honest, to even take it on because it seemed so hard. We thought, how can we really impact that? So I think our staff absolutely, when we shared data with them, it wasn't, anything that surprised them. They knew about those kids sitting in their classrooms that were struggling, and they had filled out the crisis referrals, So I think, looking at it big picture, when they saw it wasn't just them, but it was district wide, we had those same issues and numbers, then there wasn't anybody that didn't understand that was a need. They just did. They knew it too.
Yeah.
The why was clearly there. And then I think that we thoughtfully did scaled implementation. This was not a one and done type of event. And that what has made a world of difference, because some who weren't on board, maybe after initial training, over time of having additional support, having the consultant come back in quarterly and talk with what we were experiencing and struggling, providing supports in the classroom that supported what the curriculum was suggesting they do, such as students having fidgets at their desk or having sensory paths in the hallway. We've been trying to thoughtfully scale out that implementation and not do everything as a one and done and roll it all out at once, and then providing that support along the way. Those have just been the critical pieces to long-term success and continual buy-in. Buy-in's a coined term sometimes, but I think it's more that if it's working, that's what we do. And when we see something's not working is when we all start looking for something different. And in this model, it's working for our students and it's also supporting our staff. And so that's what makes it successful long-term.
Yeah, and I think Nikki talked about something that was actually really critical about the quarterly meetings that we had with the consultant who came back in. Because actually, as we started implementing, the training was great. We started implementing, and then people would say, well, I'm doing what they said, but it's not working, or I'm still having trouble with this behavior. And so they were, they weren't sure, they wanted to do it, but they also needed to address the discipline issues that were still a part of kind of their classroom environment or school environment. So I think having that ongoing conversation with the consultant, so as they tried things and things didn't work, they had support, was critical. If we hadn't had that part, I don't think that we would have been able to move nearly at the rate we've been able to, I think.
Yeah, that just shows your commitment to, this is not a one and done thing. It's going to continue. And so we're going to give you a hand, we're going to help you along the way. So that's a smart idea. And I think it's also smart that you're doing the train the trainer to sustain it past now. And of course, with COVID, everybody or a lot more people are buying into SEL and the emotional supports, both again for staff and for students. So good timing on your part. Teresa and Nikki, I know this is short, but I just wanted to get an idea of what good work you're doing with the Comprehensive Counseling Initiative. It sounds wonderful. I know you have a lot more that's going on, but thank you for your time today. We truly appreciate it. And good luck with the rest of your program.
Thank you. We appreciate your time.
Thank you.